In the greatest name of Almighty Allah, who is Rahman and Rahim.
Welcome back to Dr. Najam Lectures.
In this video, we will talk about the APGAR score.
An APGAR score is calculated at the first and the fifth minute of the birth to calculate whether the newborn requires any kind of the medical intervention or not.
So we know very well that in the APGAR score, we have the 5 main criteria.
Yeah. These 5 criteria includes the appearance, pulse, grimace, activity, and the respiration.
And for such kind of 5 main criteria,
We have 3 scorings.
So 0 scoring for
Very low activity or no mobility.
no mobility, and 1 score was,
For the intermediate mobility or the activity.
and the score 2 for
The good activity.
Okay.
Or the normal activity.
So take from the APGAR entire word, take one word that is basically known as the A, which is basically known as the appearance of the patient or the baby or the newborn. So when we talk about the appearance, we tell that we have the 3 main criteria. First is basically if entire baby is basically blue in the color or the pale in color. The entire blue in color, it means basically baby has a cyanosis. The pale in color means the white in color. So marking criteria for such baby will be 0. Okay. If the baby's extremities are basically blue in color, but rest body is basically into the pink color or the normal in color, so this basically in the medical language known as the acrocyanosis. And marking for such kind of baby is basically 1. And if entire baby's skin is basically pink in color or the normal in color, and what we call this? We call this the normal skin texture. And marking criteria for this basically is the 2
points. The next one criteria is pulse. For the pulse, we can use a stethoscope to measure the pulse rate. And normally, we can approximate the pulse rate to the heart rate of the baby. For the heart rate, we can measure at the pericardial area, left to the sternum at the 4th intercostal space. And we can measure the heart rate in the time period of 6 seconds. After the measurement for the 6 seconds, for example, if the baby have the heart rate of 7 in the 6 seconds, so we multiply it to the 10 for the calculation of the heart rate in the 1 minute or the 60 seconds. For example, multiply the 7 with the 10, then its heart rate is 70. If there is no any kind of the pulse or no any kind of the heart rate, so we give in to the point 0. But if the heart rate is less than 100, so give it the point 1. And if the heart rate is more than 100, that is the normal heart rate of the baby or the newborn, give him the point 2.
Now come to the third important point in the APGAR score, that is a G, which is the grimace. And it is basically response to any kind of stimuli or the irritability. For example, if I pinch this child and child is not giving me any kind of a response, so this is basically known as a fluffy, and for the fluffy we will give the point 0. And for example, if I pinch this child and child just shows the facial expressions but no any kind of cry, so for this kind of a child, point will be 1. And third point is basically if I give the stimulus to this child and child show me prompt response or the hyper response in the form of cry, in the form of sneezing, so or maybe the reflex back or pulling back to any kind of reflex, and for this kind of baby we will give the point 2.
Next one criteria is the activity. If the child is not showing any kind of activity, like his arms and the legs are in the flaccid condition and not showing any kind of activity, we give him the point 0. But if the legs and the arms of the child are in the flexed condition, both of the limbs are in the flexed condition, so we give him the point 1. But if the baby is showing active movement, like the baby is moving his arms and legs actively and giving an active response, so give him the point 2.
So in the last, what we have the respiration. If there is no any kind of respiration or the breathing, so if there is an absence of breathing for this kind of a child, marking will be 0. and if there is a irregular breathing in the child and little bit cry, so or the mild cry, what we call this they call the mild cry,
Might cry.
and for this kind of a child, marking will be
One.
1. And if we see the child breathing that is normal, regular, and a strong cry, and for this kind of a baby, we will give the marks 2.
Now, this is all about the APGAR score criterias and the scorings. Now we further classify after the calculation of these 5 scorings. Like for example, if the classification falls in between the 7 to 10, this tells us about that the baby is in the normal condition and don't need any kind of the medical intervention. But if this criteria of the APGAR score falls in between the 4 to 6, so this means that the baby needs some kind of the medical emergency or the medical help, like the baby has any kind of the difficulty in the breathing and may need help for the breathing. So the third one criteria, if the APGAR score criteria falls below the 3, so the baby needs the medical resuscitation, which includes the airway, breathing, and the circulation. So most of the this criteria, which is less than 3, is mostly associated with the prematurity or the preterm babies. So this is
So
all
this
about.
was all about the APGAR score. I hope that you like this video and do subscribe to Dr. Najam Lectures.